Bali. My talk is on healing the child within. This is the foot touching the ground ceremony in Bali. See, for 6 months, children are not allowed to have their feet touch the ground. They have to be passed on from adult to adult. Okay? Have to be carried all the time. And when they're finally allowed to touch the ground, there is a big celebration. You know, I think it's like, I came to America and I went to India. I go to India every year, but one time I got a ride from this cab driver, and he told me like how he had taken 6 months off from work, and how he would grind up almonds and make all these things for his wife during the time that she had a baby. And I think, you know, I went to Harvard and studied infant psychiatry, and I was working 14 hours a day during the time that my wife was raising my daughter. And you know, it shows that knowledge doesn't always translate to insight, and there's a big well, I'm working on it. I got this picture because it kind of shows a little bit about what infancy is like, your total sense of being protected in the environment of initially the mother. When I talk about mother, I'm talking about the mothering process. The mother can be, most of the time, the mother, the natural mother, is of course the nurturing person and accomplishes the task of mothering, but it doesn't mean that other people cannot do the task of mothering. But when I talk about mothering, I'm talking about the sense of being the primary nurturing, consistency, bliss-providing person. This is a picture that one of my patients drew as a part of his inner child work. Problems with depression, sexuality, suicidal thoughts. He had been molested by family members and was repeatedly raped during his adolescence and stuff. Okay. I just want to turn on the lights again. Let me read out a little bit that I wanted to share with you. It's about body work, and I had mentioned earlier that I tend to get a little fragmented. Hopefully I am going in the same direction all the time. It's about body work, and this is from Plato. Did I say it right? Plato. One thing, Socrates, I must say, is talking to Socrates, I must say, which you will find unbelievable, but which is nevertheless true. I never learned anything from you, as you well know. However, I profited when I was in the room with you, even when I was only in the same house without being in the same room. And when I was in the same room, I would have my eyes fixed upon you while you talked. And I felt that I profited more than when I looked elsewhere. But most of all, I profited when I was seated next to you and when I touched you. Touch is the most important form of communication. That is how we come to recognize the world around us. When we cannot hear and when we cannot feel, it is being inside. Our sense of contact is the most important one. And along with touch, touch and smell, these very, very primary sense of connectedness to people is still the most powerful thing that in our lives all the time. People are more driven by the smell of their partners and who they will choose than many other things. Okay? It's the very, very powerful things. Contact is so, so powerful. And to me, body work, working with the skin and working with the muscles, the most significant way, in a sense, of getting in touch, doing this inner child work, both as individuals and as professionals, really, is body work. I can't tell you how important it is. I mean, I have been getting body work done for probably the last 7 years. I came up against tremendous opposition. I had to surreptitiously take my patient out of the hospital. This is in a all-psychiatry hospital, all-psychiatrist hospital in the LA area, to do this really illicit form of treatment where I could allow patients that are tremendously wounded. They wouldn't accept the diagnosis either, meaning I had to fight all the time to diagnose my patients that were borderline or had addiction problems, self-mutilation, as having PTSD, because the psychiatrists didn't buy that they had PTSD. They couldn't see how a little rape here and there when they were children could constitute PTSD, because PTSD was what veterans had, not little children that were raped. See? They preferred that I diagnose them as borderline, because that was something that empowered them, of course. And you never touched borderlines, of course. They were to be shunned because they had such fragile boundaries, so you never touched them. I think all borderlines need to be, I'm not saying that as therapists we need to touch them, but body work definitely has a place. And I think even as therapists, with all the bad press that therapists have gotten about touching, and we know that 1 out of 10 therapists have sexual intercourse with their patients and all of these things, I think one has to define, for each of us we have to define how much can we touch the patient, because there are many, many times when our patient will be a place of such intense loneliness, such intense anguish, when they are so parted from the world, that it is important, even if it is leaning across and touching them on their hands, that you do so, and that will break them from that prison where they have been for so long and never feel. And you may make a significant therapeutic change in that one session than you may have done, or somebody may have done in 5 years of looking like a blank mirror or blank screen. Right? You know, our brochure says that everyone talks about healing the inner child. We do it every day. I'm going to talk a little bit about how we do it in the program, and then side by side, and especially later on, talk about some of the things that we focus on in terms of self-help, healing the inner child, which to me is still, as I said earlier, all work that is directed towards a person getting better in therapy is directed towards them helping themselves. Any work which keeps them dependent is really not helping them ultimately. It cannot be for them. It may empower you to stay 5 hours on the telephone with your client, but it really doesn't empower them. Because the truth is you can never be there for them. There is only one time in life when there is someone with you all the time, and that is when you're in the womb. From then on, object constancy is downhill. I hope you have gotten some idea of what generates the problems of codependency and the so-called psychiatric problems and behavior problems with all their various labels, and how abuse and deprivation in childhood and infancy has so much to do with how people abuse themselves, abuse others, lose their boundaries, act out sexually. I hope you've gotten some sense of that from my talk early this morning and the previous talk here. But suffice to say that you learn to adore yourself, you learn to adore the world, You learn to adore your body, your rhythms of waking and sleeping. All of this have a lot to do with how you were within the womb and how you were in the first year and a half, the first 3 years of life. There is, by all accounts, there is a certain degree of autonomy that we reach by the time we are 3 years old. That is true, whatever literature you look up, Margaret Mahler, all of these things. Infant observations, all of these things. If you look at the growth of the brain, there's tremendous growth up to that point in time. When you get to about 4, it narrows down, which means the brain is constantly growing and changing, growing and changing. Some of the really interesting work is how learning disabled children have large gluts of nervous matter that has not been broken down. So birth and regeneration and destruction is a continuous process. And there is a constant tailoring of the mind and the brain with all its prolific external thing. To me, there is no difference between the part of your brain that wiggles your toe and the part of the brain that does the thinking. It's all one and the same. And how tightly it is connected to the endocrine system. Does any of this, I don't know how interesting it is, but to me, this is a large part of my excitement. Seeing the connections between the mind and the body, the brain and the nervous system and the immune system, because I think about what happens to a child in the womb, toxic things and nice things. What happens to the child at the time of birth, toxic things and nice things, all leave an impression on the brain and on the body. And part of understanding where our therapeutic efforts have to be directed have to do with recognizing failures, these deviations, and these injuries. So I have to say that when you talk about abuse, deprivation, the lack of provision of a harmonious environment of sleep and waking, we have to get to the roots of of how important these things are, so that you can begin to make changes. A case in point is like my insistence on patients going to bed at 11. Which is like a rule. All people that have been abused in childhood have sleep problems. Some will tell you that they sleep great, they sleep 14 hours a day. If you're sleeping 14 hours a day, you got a sleep problem. No? You have good quality sleep when you wake up feeling refreshed. There is only one indicator whether you have healthy sleep, and that is if you wake up feeling refreshed. It doesn't matter whether you sleep 5 hours or whether you sleep 8 hours. It matters whether you feel refreshed, that within a half hour's time, your level of cognitive clarity and emotional and sensory excitement togetherness is good enough as it will be for the rest of the day. Okay? That's what tells you got good sleep. If it takes you an hour and a half to wake up, you haven't slept well. Whether you've slept 14 hours or 3 hours, it doesn't matter. You haven't slept well. Sleep takes the mother's place in a sense as we get older, and it nurtures the brain. It is the womb that we go into and regenerates the brain. See, it controls the endocrine cycles. It takes the large cycles of the universe, like the length of the day and the seasons, and it ties it to the cycles within your body and your mind and your brain and your endocrine system. Like you've heard of dexamethasone suppression tests and all these things, the pineal gland, all of these. But there is a rhythm to our body. And those that live in fright and who are born into people that live in fear and fright don't have these rhythms. So it is especially important that when you're dealing with abuse-related problems, addiction problems, one has to use sleep and waking and balance these things so it has a harmonious rhythm. There is one thing that always excites me. It's like around 2 o'clock in the morning. See, it's not just sleep, but this REM sleep, non-REM sleep, sleep that heals your body and sleep that heals your mind, sleep that helps you plan and test run the goals in your life. You need a balance of sleeps. And it is this balance of sleep that controls the endocrine system. At a certain point in time, you get this pulse of growth hormone. Like you have this change in your sleep, and you get this whoosh of your growth hormone. And then the growth hormone goes all over your body, and it sprouts your blood cells in the end of your long bones and in your splenic system, and it invigorates your immune system. It's all one big magical thing. It's so beautiful. To me, it's like going to Disneyland every day when I do this kind of work. It's really wonderful. Anyway, but I say these things because when you talk of inner child healing, making sure that they protect their bodies, making sure that they eat healthy, making sure they get rest, are not something that's out there. It's not an afterthought. It is the very essence of self-nurturing, something that has not been given to them because the people that raised them didn't know and didn't have it within themselves. So you've got to see PTSD, early childhood deprivation, like a psychoneuroendocrine immunologic problem. The whole expanse. I mean, between 50% to a third of all the fibers that are in the limbic system go into the hypothalamus and the endocrine system. So the endocrine system and the immune system are very, very tightly coupled. So when you talk about things like PMS and stuff, these are strong indicators. Pelvic cysts, these are strong indicators that something is happening wrong in an endocrine system and there isn't enough self-nurturing taking place. One common presentation for women is chronic pelvic cysts. Chronic pelvic cysts are a very strong indicator of childhood abuse, including incest. Very, 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 very strong indicator, chronic pelvic cysts. It's because the whole endocrine system has gotten out of whack. Okay? The FSH, the LH, all of this is out of whack because it's like a cascade that comes down from your hypothalamus and it's fed back and the whole rhythm changes. So, once again, at the core of addictions, major psychiatric illnesses, and codependency again is an abusive, non-nurtured, prenatally vulnerable infancy and childhood. And so all work that has to be directed towards getting the person must be focused in that direction. As I was talking to some of you earlier, I felt that the most useful work for me to do would have been, at the time when I finished my education, was to do early intervention with the very young, people that were at risk, to encourage ghetto mothers that were on cocaine, give them enough support so they would breastfeed their children, so they would bond with their children and enjoy rather than look for the next cigarette break within the hospital. No? To massage the mothers so that they in turn can give love and compassion and enjoy their children. And I found out, of course, that not many people thought it was so hot and you didn't get paid for things like that. And I mean, I still do a lot of that in terms of individual work and stuff. But this mothering of the mother, I think is very, very important. I think it is much better to talk to a young couple that's at risk with compassion and give them good knowledge about taking care of themselves and each other during the pregnancy and during the newborn period than spending months of psychotherapy on the mother and child later on. Because children can bring people together. They are like, not just in a negative way of having to hold them together, but the birth of a child is magical. And it brings a kind of wonder into a couple, or it can, if it's done right, and if the couple themselves get some support. I think a little intervention at that time can make a big difference. But also, when you talk about adult recovering and doing the inner child work, treating the child within, you will find, gives a tremendous amount of change within the person. If it's worked on within the person, or if it's provided for the patient, more than regular psychotherapy and all the other things, though it can be part of it, it can give tremendous movement and recovery. People that are blocked for years in therapy can make change in days and weeks and months like nothing else. because you're working at the source of problems. So it's at the core of all the work that we do. I had, just before I came, one of the therapists said that his patient was coming in and telling him all this really disgusting fantasies evolving around violence and feces and things like that. It's a really very timid person, very highly educated. He wants to change from being a computer person to being a mental health professional, and he has the brains to do it. You can look at this person and you see like he lacks vitality. He is not there. He grew up his father was an alcoholic, he was a physician. A lot of codependency in the mother, sexual abuse by male cousins at an early age. A lot of fears around sex, lack of pride. And I told the therapist, he wants to hear you. I mean, sometimes all you need to do is hear a person that is covered with filth and let them know that you can sit with them. Just being with them when they feel disgusting about themselves and they're smelly, or they tell you that they're such awful people, is all you need to do. And it may do more recovering and more real help than all the interpretations that you will make. It's just being there with them. So, all addiction, major psychiatric problems have to do with the PTSD of early childhood. Now, yes, it produces changes in the brain. All PTSD, what happens is, it seems to involve two major systems. People that suffer acute PTSD problems seem to have problems with the norepinephrine system. It's more like anxiety, panic, hyper type of stuff. And people that have chronic PTSD, the kind of people that seem to lack energy, you see a lot of anorexics in that type, hyposexuality, hypertension, like the autonomic system is downgraded. A sense of tremendous lack of power. I mean, these people have problems with chronic depression and stuff, as opposed to mood swings and anxiety. And they seem to have problems with the serotonin systems. Something happens at an early stage of life when there is a lack of nurturing. Norepinephrine, norepinephrine, and the second one I said, with chronic PTSD. When people have chronic PTSD symptoms, which is more common in the abuse survivor population, less common with the Vietnam veteran, the one that's making all the noise in the bars kind of symptoms, or in your outpatient department kind of symptoms. Chronic PTSD found in incest survivors, for example, has more to do with depression, more to do with the serotonin systems. It may change tomorrow, I mean, this is something chemically happens, but just because something chemically happens doesn't mean you got to rush in there with chemicals. There are studies that, for example, if a child is abandoned, like with all the Harlow studies with the apes and stuff, you have an increase in opiates, because opiates means you can withdraw. You find this, you get this false sense of contentment. You shoot up with heroin, and you're locked in your own world, and there is a temporary sense of bliss. The people that, when I talk to Vietnam veterans, the ones that went through combat with a relative sense of safety, when things would be blowing up around them all the time, but they could stay with their guns and their gunships and keep on shooting civilians and soldiers, and were the ones that were unmoved because they would be on heroin. So heroin allows you to get a sense of calmness. And when I see heroin abuse and opiate abuse, heroin abuse, minor tranquilizers, and sedating medication strongly indicates a very unexciting, abandoned type of childhood, of infancy. Okay, a very important thing to look at in terms of what kind of preference do people have in terms of drugs. It can be a strong indicator for what happened to them in their infancy. Exciting drugs, more hallucinogenic type of drugs, and drugs that essentially help you to disconnect So with all of these people, there is a PTSD that has caused some kind of brain changes, and that brain change also accounts for the disturbance of sleep-wake rhythms, disturbances of bodily endocrine rhythms. At a more subtle level, it causes learning disabilities and stuff like that. So such a child becomes more vulnerable for later psychopathology in terms of how they connect to the world around them. And unless this is noticed, the parent may not make corrections at that time. They may just figure that this is the way the child is, instead of actively moving to reestablish that connection. We assume that all people that come from this kind of background, if they have long periods of not doing well in psychotherapy and with all the other things that they're doing, that they have psychogenic amnesia. By definition, if you remember it, you know, it would not be psychogenic amnesia. That a lot of people that are not doing well in their recovery have psychogenic amnesia for early childhood abuse or deprivation or something horrendous that has happened. And especially at a later time, if there is large gaps in memory, then that should make a person even more suspicious and point the person towards addressing those. It isn't, you're always hurt by the things that you don't know. I mean, abuse is not, especially incest and sexual abuse, are not things that get cast into a neat little packet and get stored. These are like prolific abscesses within your body, things that are like nuclear waste, that poison your system, that take away the quality of your hugs and your lovemaking and the way you look at people's eyes and your creativity, and it tears up your sleep. It's there all the time. You're affected. So one has to go back to the memories. One has to go back to the feelings to work towards recovery. And much of the inner child work is directed towards remembering, recalling, and working through. To say that I don't want to do the work, or to go along with your client, that, okay, if you don't want to talk about it, it's all right, and to continue that as opposed to having them find ways of being able to bring it out. It's like saying you don't have to listen to the screams of your inner child. That just like your mother turned her face away and went on watching the TV when you told her what your stepfather did, you are now turning your back on the child that wants to speak out. Okay? So our willingness as therapists to pursue the details, even when the patient doesn't want to, is strongly, is very much a part of helping them hear, reconnect, and work through their inner child. And we are the ones that need to provide them the tools so that they can hold the hand of their inner child and give them various self-soothing and self-nurturing ways, reconnect them to their power so that they can get into the mode of listening to their inner child. I think good history taking is important. Are we still mainly professional people here? Anybody here just for personal growth? No, okay, that's fine. Okay, history taking is very important. There is no limit to how much you can push with history taking. It is very, very important. You need to get into the details of the abuse. You may not do it in the first session, but it is absolutely important to get it. And you will find that a lot of them, even though it may be very painful, feel significantly better connected, more hopeful. I'm sure as people that deal with abuse survivors, you must come across people who have told you that they have been abused for the first time, even though they've been years in therapy. And I've never had a patient come and tell me, Doc, you brought out this stuff too early. I've never had anyone come and tell me that. Yes?
I was going to ask you, you want through all of the details of the abuse to come out early, but a lot of times I found that it's the telling is the sin, and that you can't get an abuse survivor to actually verbalize what happened.
Yeah, the thing that there is still a secrecy pact and people don't want to talk about it or are ashamed to talk about it. Yes, that's true, I think, for a lot of things, but I think the sooner you move with it, the better. I am one that doesn't believe that you need to wait for months. Part of being able to hear their wounds You have to provide the environment. I mean, you have to provide the other things. I tell people from the beginning that I will get into their wounds. I will tell them to make sure that they have acquired sponsors. I will usually call in significant others, whether it's parents, kids, spouses, boyfriends, other therapists, and give them some kind of written thing that they need to follow as a part of doing this work, including body work, exercise, and things like that, before I kind of start breaking into this, to create a mental preparedness. But I will tell them that there has to be a certain level of desperation to come in touch with the memories, okay? That they have to be dedicated towards that. It's not just that it's very, very important. How important you feel is how important you will be able to convince your patient about being able to open up with the memories. If you don't feel it's important, if you think it can wait for another 6 months, or it can wait for another year, or maybe never. I mean, after all, I see lots and lots of people, or have seen lots and lots of people that have been anywhere from 2 years to 20 years in therapy where it's never been touched. So you have to communicate to them that this is something that is taking away from the quality of their lives. This is the reason why they have unfulfilling relationships. This is why, even though they've gone to college, they are still in the same job, at the same pay for the last 20 years. All of that. That the lack of blossoming as individuals and not feeling spiritually growing and not feeling creative in their work and their lives has to do with this toxic encapsulation that they're carrying within themselves. What if you're working with small children? I think it's important to get in touch with wounds even if you're working with small children. Children should talk about the details of what happened, but just as important is encouraging them to use it in play, through drawings, all of that. And I also like them to talk about it when they're with their parents, if the parents are not the perpetrators, to do it with them. The longer these memories and the feelings that are connected to these memories, bodily memories, the memories of being raped, the memories of being tied up, the memories of being made to feel like you're a piece of crap, the sooner they are ventilated, the sooner they are talked to with other people that will not abuse you, the easier it is going to be able to integrate these experiences and to go on with your life, as opposed to forming symptoms of various kinds. So there is no reason why a 6-year-old should wait till they're 15 years old before they can start verbalizing what the abuse was all about. Okay? I mean, for years I just treated children with things. I mean, I feel very confident about that. In fact, though this is not, we've done hypnosis and cell interviews on people that are as young as 8 years old. It's not something that I advocate all the time or think it should be done all the time, but there is certainly a place some of the time. But I do consider getting in touch with the memories by any way that you can to be absolutely vital and central to the problem of getting in touch with childhood and doing the inner child work. Yes?
One quick question. I have two clients who have been in therapy a long time, who have worked very hard. We've been able to piece together what happened through transferences, feelings, histories, things that they can remember happening without specific memories. Are there some memories that are so awful that they never get into their mind? I mean, they have body memories, they have feeling memories, but there's never been a picture to go with them. Then they still have like belongings.
But are there memories that are never accompanied by pictures? Yeah, all the time. All the time. In fact, some of the most toxic memories are those that have to do with no picture memories. And those are the kind of people that you'll find is the person that after a session screams, has tremendous misplaced rage, even though there are no pictures. When as in the course of their therapy or their involvement in 12-step groups that are trauma specific, like when they go to ACA meetings, or they go to incest survivor meetings, or they go to sexual addicts meetings, the kind of doors and windows that get opened, and the kind of feelings that come out may have nothing with picture memories. But what they feel is they may get tremendously suicidal. They may get tremendously hopeless, like this wave of hopelessness. I mean, people will get completely paralyzed, catatonic for days when feelings like this hit them that have to do with memories. And we deal with that all the time. And yet, it is important that the person pass through those things. This is the real pain, the real grief, the real sadness, the real powerlessness, the real terror that people have to get in touch with as a part of being able to get beyond them, to feel them, to experience them, and to know that they can still hold themselves together and get beyond it. I will leave about a half hour or 20 minutes at the end so we can go through the questions more thoroughly. I just want to make sure that I hit everything that we have here. So, history taking, very, very important, including details, including their lifestyles, their relationships. Very, very important to get history about grandparents, parents. I ask people all the time, how did your parents meet, you know? And did they fall in love with each other? Was your father we cannot assume that everybody was born in love. It's nice to think that children are these cherished things that are born in love between two people that are just ecstatic over each other. The thing is, that is a nice fantasy for many, but it is closer to the truth that many of our patients have drunken fathers or rapists that climbed off them in some kind of drunken fugue, you know, after having called them names and brutalized them. And this is the genesis of their birth. And it is important that they confront these feelings. It is important that they recognize that they didn't come from a place of great love and admiration and mutual respect, and it was much less than that. And they cannot get their emotional and spiritual energy from people that didn't have it, and therefore all the more reason to make the journey within themselves and connect to their own spiritual energy and their own inner child, their own vision, before they can go on with the journey of life and make changes for themselves. Okay? They have to feel the sense of rejection in as much as possible. And it is good to be able to do this kind of work, the sense of rejection and disgust and self-loathing and rage, in an environment where you can tremble and feel cold and people will hold you. Very, very important. You will see a lot of this just as a part of history taking when you get into the details of this stuff. I also look into what are their strengths. When I was doing my child residency, I used to put down strengths like not psychotic. I mean, if you're not psychotic, that's a strength. It helps a lot if you don't hallucinate, you know? Makes a big difference. It helps a lot if you're not constantly self-destructive or self-mutilative, you know? So you take an account of their capacity to carry on fighting, because you know they got it in them. I mean, these people that come to us, adults that have jobs and all of these things, are survivors. You know? They have tremendous reserves of courage and energy. You know? There is a tremendous flame within them that we can connect to. Knowing that it's there is very, very important. And then you just try to find it. Where is it living? Where is it blossoming? Because it's blossoming somewhere. Maybe they're writing poetry. Maybe they are playing they are playing marbles well. Or maybe they like to ride a bicycle and enjoy nature. You know, but there is always a magic within people that even from your history taking you can begin to focus on. Like maybe somebody likes to surf, and you see this like this rope that helps them climb out, this part of them that connects to pleasure, non-destructive fun. Okay. Groups. I think it's very, very important that people attend groups. You don't have to, I mean, inner child work is not like something that's out there. I mean, that is only available if you have lots and lots of money and you go to John Bradshaw Center or here or there. It is something that most of us and most of our clients can do the majority of work on their own. But it is important where you focus. You can go forever in the wrong direction and move as fast as you want, but never get better. You can hit 90 meetings in 90 days that have to do with something that only peripherally touches their issue. And I see this all the time. A person that comes from an ACA background, that may have incest issues, that has had problems with alcoholism, chooses only to attend AA meetings. Even if they go for 30 years for AA meetings, is not going to get well enough, is not going to recover and grow to a level of emotional, spiritual, and creative recovery as somebody that early on addresses the issue of their ACA. I don't want to attend ACA meetings because they make me feel painful. That is the reason why you need to attend them. In my book, I've talked about Vietnam vets that are alcoholic. See, when you're a Vietnam vet and you have an alcoholism problem, you can't talk the same language with regular, you have a double wound, okay? You have to go and tell them how you killed little babies or raped women while your buddies held them down in the drunken madness of war, and you are still hurting from all of that experience, or with other people that cannot then, that are going to kind of move their seats a little bit, that don't hug you just as strong, or look the other way because of what it does to them. Okay? You got to do it with people that have a common wound. And the longer that work is put off, the longer it takes for your inner child to be able to repair itself and get connected and work through the problem. So, trauma-specific groups, very, very important. Very, very important. I feel like if people are just attending AA or if they're just attending Weight Watchers, if you've got an eating disorder problems, because it's a lot easier for somebody that's having a serious eating disorder to go to Weight. How they found these new recipes and Good Housekeeping, and this is really, 10 calories less. It's like those people that are out in the cafeterias, that are like hugely obese, and they're sitting with this little salad, and it's not true, and they're lying to themselves. I mean, it's like this big denial. It may be much easier to talk about how you triumphed over a box of candy than talk about how the stepfather that you have to visit, so your grandmother, that your mother and stepfather are happy now that he's in the 70s and benign, and he doesn't want to beat you around and doesn't want to rape you, instead of talking about the abuse. The person carries the shame, and they don't want to let go of the shame. It is a secret that they keep within themselves. And unless they're willing to open with that and not guard the people, they're not going to be able to make active movement and recovery. They're not going to be able to let go of the shame. They become co-conspirators in the sickness. So attending trauma-specific groups is absolutely essential part of the work of repairing one's childhood, with a strong focus on abuse. In our program, for example, early on, we have people talk about abuse. We don't wait to talk about sexual abuse and incest as an afterthought that happens in the 3rd week of hospitalization, 2 days before they leave the program. No, it is something that their peers will talk about from the day that they come in. So there's a lot of peer pressure. And the thing is, within the sound of the peers' voice, the tone of their voice, and their bodily postures, and the mental pictures that are painted, all kind of things happen within the person that is hearing it. I see people get better from incest wounds all the time by attending incest survivors meeting and leading relatively non-destructive lifestyles. I don't think this is too massive of a human problem when you talk about 1 out of 4 or 1 out of 6 or 1 out of 10 being incested, sexually abused, and all of this, to think that everybody's going to be able to afford Michael Stone's 8 years of intensive psychotherapy. Okay? Michael Stone of the borderline personality disorder fame, says it takes an average of 8 years of therapy. Where's all the money going to come from? No. My experience is that many people, because of precious connections that they make in their lives, significant figures somewhere that provided like this ray of hope and strength in their childhood, people in their lives heal all the time. I think incest survivors and abuse survivors heal and become wonderful people, stronger people in their lives all the time. I don't think they all need to go. Some of them kind of come across these things on their own. Some of them get nudged in the right direction. I don't think everybody needs long years of therapy. But I think when you do therapy, I think it's important to know where your efforts go. So the focus is on recalling things, whether it's in 12-step groups or it's a lot of these incest 12-step groups, so there tends to be a lack of empowerment. It is women and men that tend to get huddled. There is a sense of being huddled in a common wound as opposed to being vigorous in a heroic battle. And a sense of huddling is not good. And when people are not working the full program and they're not exercising and they're not doing the work of confrontation, it just becomes like a huddled victim group without a sense of movement.
Are you using just being able to withstand today and this kind of thing?
Or worse, and because I mean, like huddling as a habitual process, I don't mean just gathering together and becoming strong as in drawing from each other, but it's like tuning up your sense of victimization more by becoming like this huddled mass, okay? As opposed to becoming stronger as a whole. And a lot of the incest survivor 12-step, some of them degenerate into that. And I think it's very important that people be, you can always change the groups, you can always start your own groups, so it's not like, but I think the therapist-led groups have a place, at least for getting people started. Nudging by a therapist allows them to open up and start talking, and then later on they will feel more comfortable about talking in 12-step groups. Okay. Massage and body work, again, absolutely essential, reestablishes boundaries, gives a sense of nurturing. For people that have only known touch to be violent, sexualized, or who have not been touched, this touch, as threatening as it might be, it's an important part. If you have to walk in this world thinking that the next person, that if a person is coming close to you, they either want to beat you up or they want to feel you up. The world is not a safe place. If you cannot feel comfortable in the embrace of people, where physical contacts feels like caring and love and a pleasurable sensation, you're not in recovery. I've had people that have been in therapy for years and years. They balk at the thought of massage and body work, and some of them will leave you because you insist upon it. But then my own feeling, after having done this for years and becoming increasingly more consistent with that, is that you help them a lot more, because at some point they will come to the recognition that what you said was right and become stronger in their efforts to pursue body work and heal their bodies. So body work teaches them self-massage. It teaches them how to get good feelings from their body, as opposed to the only good feelings are when you put a razor to your wrist, or the only good feelings are when you stuff things inside your rectum or your vagina, or when you masturbate continuously in a destructive manner. Body work, I also talk about autonomic massage. It's like, I think about taking showers that are like hot and cold, rubbing your body vigorously to be very, very helpful. I tell patients if taking a Xanax, you do that. I mean, I have often used this as a way of calming down people that feel panic-stricken, dissociating, having anxiety symptoms, feeling totally overwhelmed, to do this, using what I describe as autonomic massage. I will often tell people to do sit-ups and push-ups in my office as a way of calming them down, right on the carpet, right there during the session. No, I mean, it might be a little different, but I have found out that it really, really helps. Okay, so this is all, to me, a part of body work. Oil baths, giving oneself an oil bath, anything that stimulates your skin, stimulates your muscles, all of this is really part of the body work. The more elaborate form of body work which we do is at the center, and which I also have other people that are specialized to do it, is it basically consists of seeing the response of people in different positions. When people are laid on their back or their belly, it may invoke very strong memories or feelings. It may invoke flashbacks. Flashbacks can often be used to help the person reconnect to abuse memories. It is one way of getting in touch with childhood. That a person, I mean, I had this physician, and we did everything, and ultimately the only way that we broke through to where we discovered memories of her being abused by her mother and her mother's friend, physically, ritualistically, and sexually, was by body work. Again, some of these are not going to feel comfortable if you just advise a person to do it. Some things can only be gained in the compassionate environment of another human being and cannot be accomplished in aloneness. Some of these can be done with a friend or a sponsor or a spouse, but having the person on their specialized forms include having the person in different positions, seeing the response to having their legs moved, having their arms moved, being touched on the head. Each of these, so positioning the person in different ways and seeing how they feel. How does their stomach react? What kind of feelings come up? How do they sleep that night? What kind of dreams come about? What kind of nightmares come about? Do they feel like throwing up if the back of the head is touched? This is all part of more specialized body work. Again, stroking, hard massage, soft massage, stimulating the joints, stimulating the skin, stimulating the muscles, all of this constitutes. And you kind of got to look for what is developmentally lagging in this person. You find somebody that has this really weakened, soft, mollusk-like body, the sense of having given up on their bodies and existing all in their head. Very common with people that dissociate a lot, very common with eating disorders and stuff. And you want to have them do body work that's more vigorous. But So you want to do like a spectrum of body work. For some people, I think lifting weights is very helpful because it gives them this kind of solid, muscular, powerful energy. For a lot of people, brisk, defensive kind of like karate and martial arts with a lot of screaming and sudden movements. See, when you felt like a victim all the time and people could do whatever they wanted with your body, getting in touch with your aggressive self and being able to give yourself the power to hurt someone and know that you can hurt someone is important. In my book, I have mentioned from my surgical background, when a person has a full erection, the person's penis can literally be fractured or it can be pulled off. I mean, I don't want my female patients or any of you, to go out there and practice it. But the point is, I feel it's an empowering message to know that you can hurt someone when you want to. And it is awful and horrible for them to think about it. But it is a power. It is good for them to have a mental picture and live with the mental picture of being able to hurt someone when all their lives they have felt imprisoned in the capacity to hurt someone, when they have been brutalized day after day, month after month. And you will find, I see a lot of their parents, bring them in for family meetings and stuff, and you really think, this is the person that picked you off the floor and slammed you against the wall and held you down and raped you? And it is. It is only in the minds of people that the victimizers are so powerful, and only in the minds of the child within them. And that is where the distortion has to be corrected. And if they don't, and all of these things are very empowering. So recently we have started this thing where I forget the exact term, but it's done by a company, but they basically teach women moves how to protect themselves from rapists. And we found it very, very helpful. Major change in their length of treatment and their movement and recovery. Okay. I wrote down babying. You got part of both treating patients that have wounds as well as for what people need to do in their own recovery is babying oneself. Recently I heard a lady that works at my house tell her, our housekeeper, tell me that one of her friends, the lady that has her work there, regularly has her take off her panties and powder her. The thing is, there is babying and there is babying. There is healthy regression and the capacity to play and acting out in childlike manners that may not be very helpful to a person. The difference between people who have been robbed of their childhood and those who have had healthy childhood is that people with healthy childhood are able to play when they want to and be adult-like and do serious things when they want to. Whereas when people have been abused, they cannot regress. Their regressions are out of control. They have taken on their father's business and they start getting incontinence. It is not appropriate to get incontinence as an adult. When you have incontinence as an adult, it means that there is something wrong in childhood. Incontinence, incidentally, incontinence, both fecal and urinary incontinence, is a strong indicator of autonomic problems. And dysautonomia, a weakened autonomic nervous system, big fluctuations in blood pressure, consistent low blood pressure, fainting attacks. These are all strong indicators of early childhood trauma. 4:30. What time do I have to stop? I started at 3:30, 4:30. Okay, I got a half hour. I'll wrap this up real quick. Okay. So, both in terms of treating your clients and for the work that they have to do, adoration and love. You have to adore them. You have to love them. You have to adore yourself as people. Part of working with your inner child is learning to love and adore yourself. Consciously taking to the time to become awed by the wonder of yourself, because no one is the same as you. You are one of a kind. Your passage through this world is unique. You are like a flower, and every flower being different in this wonderful valley of flowers, this capacity to be able to fall in love with oneself all over again which means you got to take the time. You got to be in a non-abusive setting. You got to have a clear head. You can't do it while somebody's beating on you or calling you a bitch or a cunt. It just doesn't work the same way. Okay? It can't be while your children and your husband and your boss is putting pressure on you. You got to take time. And codependents and abuse survivors have great difficulty taking time for themselves. And unless people take the time for themselves, it's not going to work. Coming to a conference is taking time for yourself. It is also giving the knowledge. Knowledge is important. There were generations before us that didn't have the knowledge. You know, we stand on the shoulders of ACA, we stand on the shoulders of AA and the shoulders of Bill Wilson with our newfound awareness of things. Generations before us didn't know that. Okay? So the knowledge is good, but it takes more than knowledge. You know? It needs to take the time. So, taking the time to be with oneself, being able to give one a sense of humor. At our place, at the program, we have like this compulsory humor thing, you know. we are compulsive about making sure and creating compulsive need for relaxation and enjoyment. We don't let them use TV. Saturday nights we provide, we bring outside entertainers and create a sense of, like we have a show, like a comedy show or something that involves dance and stuff where people have to get dressed up. They have to have their nice clothes. They got to wear nice clothes. They got to wear jewelry. They got to wear makeup. I mean, women, you know, and men have to. They want to feel good about themselves. They want to wear nice clothes, you know, because you don't want to do something. If you when you read this in other places, healing the inner child really means being able to look at your own child. If you love your child and feel relatively unambivalently loving, or somebody else's child, if you don't have your own child, and seeing how you would want to treat them. You want to see them nicely dressed. You want to see them smile. You adore them. You love them. You feel the sense of passion in their existence. If you don't like your child to wear dowdy clothes, why would you want to wear it yourself? So treating yourself the way you would love and treat a child, and creating kind of life conditions. If you don't like your 5-year-old daughter to be having her arm yanked and being abused and called names, why would you put yourself in a situation? So treating your inner child means you don't allow yourself to be placed in situations of abuse by whosoever is abusing you, whether it's your boss that is trying to get an extra 4 hours of time without pay, or telling you to come to work on Sundays when you should be by yourself. I feel like an hour a day a week, you know, a week in 6 months or 2 weeks in a year are absolutely essential elements of time that you have to give for yourself. People that don't take, you need to take vacations. Vacations, solitary time by yourself are all important. There's another reason. It is important to develop a sense of aloneness. The common problem for children that have grown up in abusive homes, and we talked about this earlier, is an inability to withstand aloneness. Because of their lack of self-nurturing, self-excitement, they tend to get anxious, alone, empty. And you have to start somewhere. So give yourself some time alone and start getting used to it, so you start enjoying yourself as opposed to having to need someone before you start enjoying yourself. Okay. Now, holding, and again, in its most basic way to many, many more complex ways. Being held by therapists, being held by loved ones, but essentially to give this body contact. But holding in a larger sense, making sure that you're in a safe place. If you feel that something overwhelming is happening, make sure that you're in a situation where you're safe. A friend's house, getting yourself into a hospital if you have to. If that's the only way, you're going to make sure that that such overwhelming feelings will destroy you if you don't. So holding can be many things. It is making sure that you're secure. But in other ways, stroking yourself, holding yourself. Something's changed. Okay. Stroking your body. I mean, I will tell people to gather themselves at times when they feel disconnected with things. I will tell people to stroke their body when they disconnect or feel anxious. I will tell people that they need to remember to stroke their bodies and massage their bodies and hold themselves when they sit through meetings where they tend to dissociate, become panic-stricken, develop nausea, vomiting, and become so overwhelmed that they cannot attend those meetings. Okay? So holding in many different ways, both by yourself, creating an environment of holding, as well as being held by bodywork therapists and others. Because this is what has failed in their childhood. There is a lack of holding, lack of containment. The container, their mother and their family environment, could not contain their anguish or their terror, or with themselves so terrorized that they could not comfort and soothe the terror and the anguish and the emptiness within the child. So, holding. We also do things like psychodrama, which is, again, I mean, how many of you are familiar with psychodrama? Okay, all right. Well, psychodrama we find a very powerful element. I think that a lot of people don't need to have more intrusive therapies like sodium amytal interviews and things like that if they do psychodrama. It can bring up a lot of memories. Something that we don't do consistently but do sometimes is tape record. Because people space out during psychodrama, so we tape record them, videotape them, and have them play it again so they can hear themselves and reconnect. So we also do inner child work, which is just psychodrama that is specifically focused towards replaying events in their infancy and childhood, as opposed to a broader. So we have some form of psychodrama that goes on every day, and we consider all of this to be a part of inner child healing. As I said earlier, mandatory play that is physically invigorating, play that is fun, play that is interactive with other people, and of course exercise in all its forms. We have people do Tai Chi, we have people run, lift weights, all of that. But we feel like you got to have at least 20 minutes of an autonomically stimulating things kind of exercise. And walking alone is not enough. And you have to get stimulated to where your body chemistry and your brain chemistry changes and you feel more empowered, so you can begin to think the thoughts that you normally are too ashamed or too afraid of thinking. Stopping addictions and codependent lifestyles, of course, are very important. When we talk about taking the time, we talk about meditation, because meditation is a form of taking time. A word of caution, I mean, not everything that looks like meditation has to be meditation. There was a story. There was a priest, and how many of you read my book? Okay, I'll tell you, it's my book. There was a priest and a prostitute, and they were across the town at the crossroads, and this priest would be there in his temple, and he'd be looking across, and he'd hear all these noises of lust, and while this woman was turning tricks, while he sat cross-legged, doing all his praying to God, and thinking about all this, like this. He'd contact people and try to get this clothes and stuff. And this woman continued her trade, doing all these terrible things. And they both died. Of course, they went up, and they're at the gates. And St. Peter is there directing them to the sides where they need to go. And just as he comes in, he sees the prostitute being directed towards the gates of heaven. And the priest thinks, this is terrible. No. This is terrible. He gets even more surprised when St. Peter tells him to go in the direction of hell. And now he's really, really upset. He says, I really need an explanation. So St. Peter runs up to God and asks him. So he comes back and tells him, The woman went him flat on her back, but she was looking across the temple, and her mind was on me, on God. And you had the hooker on your mind the whole time, even though you sat cross-legged in a posture of prayer. Everything that is meditation is not meditation. Meditation means being connected with oneself. It has less to do with sitting in a lotus posture than being connected to your mind. I mean, there was a woman that told me, I mean, every time I sat in a lotus posture, I start getting anxiety attacks. You can't do anxiety. You cannot have, for some people, it's sitting without moving raises their anxiety levels. For such people, meditation is better done with active movement, like running or riding a bicycle or something that actively causes them to feel powerful. That is more settling towards their mind. They can meditate more with that kind of activity, and this is true. I mean, if you read Dr. Benson's book, he has talked about it extensively. I mean, everybody doesn't do well saying mantras and stuff, you know. I mean, a lot of people do much better doing activity-driven meditation. Okay, biofeedback, and in its simplest way, it's taking your pulse a few times a day. You know, you don't need elaborate biofeedback. Means listening to the signals of your body. That is one time. If you take time to do your breathing, to listen to the pattern of your breathing, you're taking time to be with yourself. You're not minding about Johnny not having done his homework or not having come home on time, or you got to prepare food for your husband, or etc., etc. I mean, you are with yourself when you listen to your breathing. And there is nothing mystical, magical, transcendental, stuff. You don't have to go to any gurus to do breathing exercise a few times a day, and that too can be a way of connecting to oneself because you're with yourself. I talk about postural correction as a part of body work. I talked earlier about boots and braces, but it's simpler than that. You know, it's paying attention that you walk straight, that you keep your back straight, that you make eye contact when you talk to people. These are patients' assignments that I give to therapists when I talk to them about patients. Have the nursing staff constantly remind people to make eye contact, discuss it in team meetings when the patient is there with all the rest of the treatment staff, and focus on this as major therapeutic interventions, not as an afterthought. Because if you cannot look into somebody's eyes when you're talking to them, you recreate a certain sense of hiding. And with that, you also bottle up any chance of insight and awareness. So, looking at the things that come out of painful symptoms, physical pain, gut-related pain, what kind of thoughts go with what kind of pain? Headaches, stomach aches, colon pain. I have a patient, for example, that when we kind of marginally touched on some of her father's issues, she started having rectal pain, and many times, this was like years ago, we'll give her medications for that. Medications that are supposedly not dangerous, but it took away the pain. But eventually, it was not giving the medications that allowed her to connect the recollections of multi-perpetrator, a father and her father's friends, rectally sodomizing her as a child, that allowed her to be able to overcome. So physical distress needs to be connected to emotional memories and emotional pain. And these are all ways of getting connected. Safe holding, self-massage, trust and boundary increasing by all of these things. Now, one of the common things that we will find with survivors is the problems of dissociation. And much of the work of healing the inner child becomes difficult when people will dissociate through every situation. When you can always, no matter how horrible you feel, if you can switch it off at any time, there is no reason for real healing, because you can always keep on running away. So one of the things that has to be worked through very strongly is decreasing dissociation. In therapy itself, I will ask clients to constantly keep their bodies connected by touching themselves, stroking themselves, walking in the room if they need to. I will tell them to tape every session, because especially when emotionally painful things are talked about, it is so common for them to forget complete sessions. So taping the sessions, if they cannot afford to come frequently, it is to listen to these tape sessions at fixed times during the week, just like they were in the session, while they do the same things. If they become nauseous and feel like they're going to fall apart, let them take a shower. If they feel dirty, let them take a shower, clean themselves, anything, as long as they continue staying connected and doing the work. I've had people that have tremendous dissociation because of flashbacks. I've had people barricade their doors earlier in the day because they will start dissociating, open their doors and start wandering in dangerous parts of the town. By the time you are done removing large pieces of furniture, you are over your dissociation and you get reconnected. I have found this very, very helpful for patients because not everybody can stay in hospitals for long periods of time, and they still have to go on with the task of recovery. Memory work. Again, taking the time, doing the trauma-specific 12-step is the most powerful thing that I think that if people worked an honest 12-step, there will be less need for hospitals, and there will be much more recovery. Taking the time to think, journaling, left hand. I'm going to go through fast with this because some of these things are there in a lot of other books. I'm not going to spend a lot of time on it. But looking into doing dream work, doing fantasy, looking into your fantasies that are intrusive and painful, sexual fantasies, fantasies of pain, fantasies of violence. Dreams can be very, very powerful in recovery. It is, if you have bad dreams and persistently bad dreams, it is important to look at them. I have found many people directly connect to memories through dreams. More so in abuse survivors, they may have more than symbolism, and they may be like almost like flashbacks. Dreams have the quality of flashbacks in many survivors, and it is important to aggressively go after them, especially repetitive ones. And also, dreams can be a source of power because it connects the person to the strength within the subconscious, to all the power of their archetypical images, the heroes within themselves, the healing within themselves, and of course the child within themselves, which has all of this in their psyche. To look into the fantasies and flashbacks, to analyze every kind of physical symptom, not just analyze as in the mind, but to go through it, to connect the feelings with that, to be in a nurturing environment, to nurture oneself without the use of medications while going through the symptoms. To reestablish the rhythms of sleep and waking, as I talked earlier, to provide adequate nurturance, to eat healthy, to not eat too much or too little. Grief work and rage work, very, very important. The task of second stage recovery, the task of inner child work, a lot of it revolves around grief work and rage work. It's like I was listening to this reggae song. It's like when something like everyone wants peace, but people don't want justice. I mean, when there is a scream inside you, you can't have peace. Okay? You can't have peace of mind when there is a tormented soul that is your child within yourself. You have to look at all these painful symptoms as screams. And if you don't address them, if you don't take the time to do grief work and rage work, it is not possible to move on with recovery. And grief work can be done in various ways. Again, when you do a history taking, when you have them keep journals, when you write 20 incidents that are emotionally painful. See, a lot of times just taking the time to attend groups and beginning the work becomes a catalyst. And within weeks and months, you will see tremendous change in people. If they, at that point in time, get sponsors from trauma-specific meetings, they will make that much more movement. So, being able to shed tears, being able to feel pain, being able to recoil in pain and allow yourself to regress and become weak with someone that's not going to abuse you, whether it's a therapist or a friend or a sponsor. Okay? Allowing yourself to feel the anguish. And one way in which you allow yourself to feel the anguish is to go back to the memories, to actually say them. It is so hard for people to say them. It is one thing, again, hearing somebody speak, but the moment they start speaking, in the quivering of their voice, in the way that they hold themselves, and in the way the breath comes out of their body, you will begin to see change take place at that moment. So much emotion gets let out. So a large part of the grief work is remembering and verbalizing your grief. Some of your grief may not have pain, and all you need to do is just feel it. Even if it means feeling like your body is like lead, and you feel the sensation of somebody being dead, even though no one is dead right then. A lot of people, not necessarily people that have been sexually abused, but have a very ambivalent relationship with their parents. They may not have grieved a parent's death, or they may not have grieved. See, it is much harder to grieve spontaneously for a people with whom we have ambivalent relationship. And such grief takes a very long time or doesn't get worked on. And actually thinking about the death and your feelings around the death and going back to all the times they've hurt you allows you to kind of make the kind of peace with the person to feelings, and then go on with your life. So grief work, very important. Rage work, very, very important, whether it's with batakas, screaming, but most of all with your imagination. I think both with grief work and rage work, it is being able to recapitulate and think and use the power of your mind in creating images, visualization that allows you to do most of the grief work and most of the rage work. In your mind, which has the power, you can kill someone, you can tear them up, you can scream at them, you can run them down with your car. There are many, many things. See, but victims have a problem creating, especially women that have been abused, have great problems creating pictures of violence other than them being part of the victim end, okay? They need to create pictures. And so one of the things, I will talk to them about violence and create mental pictures of violence for them all the time, because they cannot escape that if you start painting it for them. And I encourage them to read about it, and recommend reading that specifically allows them to empower, even with the potential for physical violence. Nobody that I know has suddenly gone out and started using their newfound skills in karate to nail somebody. That doesn't happen. Okay? But there is certainly a feeling of power. Knowing that you can strike out on another person to protect yourself allows a massive sense of empowerment. But not only that, it begins to open doors of memories that were previously suppressed because this weakened person couldn't deal with that. But now the person that doesn't have the same dread of violence can deal with those memories. Okay. Again, time to play. Play has the quality of adventure, to take risks in play, to do things. You know, you've all heard about the outdoors kind of things. I forget the groups, but there are a lot of resources now where you can do adventurous things, and I suggest that very strongly for recovering people, especially the ones that cannot go into hospitals or don't want to go into hospital, all this outside survival kind of thing. I had a patient recently tell me how she went on one of these trips, and even though she's a very non-violent person, she shot a deer, and how just being able to raise a gun and shoot a deer, you know, whatever your feelings are about hunting and things, I mean, that's separate, but the sense of being able to do something that was different, something that she had never imagined that she could do, gave her a sense of some power that she had never previously experienced. Taking risks, and we talked about this earlier. People that come from abuse backgrounds don't feel right in taking risks other than self-destructive risks. Risks that where they put themselves on the line but have no real reward, no real sense of adventure. The same person that has great problem going to Magic Mountain or being on one of the rides that give you a rush of great exhilaration and joy and get you into this childlike state will have no problem going and sleeping with a boyfriend or a husband that is known to have murdered people. I mean, I see this all the time. Okay, women will not take the least chances, but they see no problem in going and sleeping skin to skin with somebody. I mean, I bring it up because I had treated a patient that I had to ask her. I mean, she saw this person beat a cab driver to death with a crowbar, and then slept with him and had sex with him the same night. See? And it is this need to take healthy, adventurous risks that are so important to cultivate in somebody for whom there is such a constricted vision of what they can do and what they cannot do. tapping into their creative self. Because anytime you're creative, when you're creative, it means you're being yourself. You're in connection with your child, whether it is doing something with sandbox or with color or sculpting or writing poetry, or when you're being creative, you're in touch with your inner child. Because, see, one of the things that there are all these, all the Egyptian stuff. I had been under the impression that a lot of these Egyptian monuments and stuff were done by slaves. I read an article recently by somebody that's Egyptian, and he says, no, these people did it because it is so beautiful that it could not have been done by people except as a part of their creative sense. Maybe they had other hardships, but at the time that they were doing this, they were creative and in touch with themselves. Things of great creativity and beauty, which carry this individual signature of a person's soul, cannot be done except when you are in touch with the most basic, powerful, and wholesome parts of oneself. I'm going to talk a little bit about confrontation, and then we're going to stop. I strongly emphasize the need for confrontation. If you continue to interact with people that have been abusive, carry on relationships with them, but do not confront them, you are putting a lid on your inner child. You are continuing to carry on the abuse. I had a woman that came back to me after she went home for Christmas and went through a terrible depression after that, even though she had been doing quite well up to that point in time. Weeks later, I found out that at this Christmas thing, her uncle who had abused her was present. I mean, this is a woman that has kids and grandkids. Her uncle was present. Her mother, who had allowed all of this to happen, was present. And she had not, it was a tremendously abusive situation. She had, in a sense, re-abused herself going to this Christmas reunion. Okay. I will encourage therapists to sit beside the patient and have them make phone calls or confront people in person sitting across from them. It is best to do it while they're in therapy, because you know that when they're out of therapy, they may not have the same level of support. People often tell me, and therapists will say that they can't do it because they're not prepared for it. See, again, the burden of preparing yourself, a burden of preparing the patient, for the patient to prepare themselves, and for the individual therapist to help patient, it's got to be done. Because as long as you don't do the confrontation work, you continue to put a lid on large parts of your psyche, large parts of your emotional experience, because you continue to live a certain kind of lie, and you disconnect yourself from large parts of your life and your pain. Not only from the pain, but also the hero and the survivor, the divine child, the heroic child that is at the center of all of this pain. Because through all of this pain, there is a jewel, there is a brightness, there is a flame which survived this. You know? It is not as if the child is dead. The child is there. If the person is alive and is in your office, or just alive and walking around, somebody very strong and powerful, somebody very triumphant is there. And if they can survive in the worst of atrocities, they're going to make it now. There are a few more slides. I'm just going to run them real quickly. I don't remember the exact order, but I think they have some relevance to what I talked about. This is a picture of that one of my abuse survivors drew. This is an actual picture of her drowning, abused by having her head plunged in the bathtub by her father, as a way of having to keep quiet about the incestuous abuse that was taking place at the time. This is a picture by Goya. It's a person being castrated during the Franco-Spanish War. The experience of castration is part of a nightmare that all children that are abused or witnessed domestic violence are subjected to. Okay? For every male child that lives through domestic violence, who has to see his mother be abused by his father or stepfather, there is an emasculation. If it is not felt in pictures, it is lived through. And such a child goes on either to become an emasculating, abusive person or continue to live out their emasculation for the rest of their lives. Well, this is mescaline. It's one way of reaching awareness, not one that I would recommend. But I wanted to, yeah, peyote, right? And but it really points to the fact that, as awful as reality might be, and as awful as the things that you may have to come to terms with, maybe it is absolutely important to reconnect to things in your mind, because this is what allows you to recognize and go beyond them. This is meditation. Again, as I said earlier, there is something about the pose. One of the things that I read recently, and it made a lot of sense, is that when you sit in this posture, you give yourself a certain kind of dignity, a certain kind of royalty, a certain kind of connectedness with somebody that can that feels less like a slave, less like a victim. I'm going to stop now, and if you have any questions, I would be glad to take them. I think I'm about at the end of my time also. Yes?
Over and over again in addiction treatment, you hear people with Tennessee Field talking about someone needs to have at least X amount of recovery before they start really addressing those issues. What do you think?
I'm so glad you brought it up. You know, I think that there is a small kernel of truth, but a very, very small one. And I think the real problem is, how fast do you push? Only a person knows how much they're losing and how much they are to be gained by getting better. You may say, I got a nice Mercedes car, and I have my third husband doesn't drink, and we live in Beverly Hills. I'm feeling good. Only you know, and only you can be honest if your cup of joy is full and if you're fully connected to the world around you. So how quickly you want to work your program is up to you. But as therapists, I think we need to point out to them that there is work to be done. And this part of your work is only going to happen not just by attending AA, but by attending incest survivors, or not just or to a male client that has somehow managed to get a good lawyer who bailed him out, even though he was caught for the third time exposing himself in public, even though he's a college professor, and thinks that now that he doesn't have to deal with it, all he has to do is attend AA, but he's not going to attend Sexual Addicts Anonymous. You got to let him know what's at stake. The thing is, who gets hurt by sexual delia and you know, perverse sexual activity? If you wear pink underwear and you're a banker and you got all this hair on your chest, or you have to walk around with things in your rectum so you feel fully alive. No, you got to live with it yourself. And you take away from your sense of pride and joy and your sense of glory. You lose out on the glory. And you got to feel desperate about reconnecting to your glory. But as therapists, we have the burden, we have the task, we have the, we need to let them know that you are missing something. No one's going to be hurt if you have to walk around with a vibrator and you got this great job on Wall Street, okay? But the thing is, you lose out, okay? So I think that the sooner you want resolution, the sooner you want to make your treatment more and more focused. You can't drag somebody, but you can encourage them to be dragged to meetings, as in you can encourage them to get a lot of sponsors. I think that people that don't get trauma-specific group sponsors are not working the program. They say, I got to sponsor an AA, my main problem is incest, I don't want to deal with it. I won't get myself much easier to talk, because a lot of AA sponsors will not talk about sexual abuse issues. They will tell them to put a lid on it. Yeah, sure. And to me, that's like you carry on the denial. So I have never seen people, the real truth in all of this really heavy, intense pushing with everything that we can has not produced any litigation for me, has not produced, I have not had, for example, thing with fewer, they'll have relapse. Relapse universally is decreased when you do inner child work. Relapse work is inner child work. Second stage recovery work is inner child work. You know, it makes you stronger. I mean, for years before I started doing sodium amytal interviews, I was told by people that had never done them, of course, that you don't want to use this because they'll become addicts if they use them. By now, I mean, almost all the people that I use it are borderlines, the very population that I'm supposed not to. People with borderline features who are almost universally sexual abuse survivors, and people in second stage recovery, people that have given up their addictions and don't feel a sense of contentment and joy and excitement in life. And I've had wonderful results, and I've never had anybody relapse into drugs and alcohol because they had something very painful come up. Does that answer your question? Yes. I feel very courageous, but it is really the courage of the people that I deal with that gives me the courage to work, because deep inside I know that there is a fighter who wants to come out and take this on and keep moving. I know that. Okay. Yes?
You advocated the victim to confront their perpetrator?
Oh, very definitely. The question is, should the victim confront the perpetrator? Very much, unless there is immediate risk of physical injury and retaliation and life-threatening. If there is a threat to life, no, you want to put yourself, then you're not holding yourself, you're not protecting yourself, you're abusing yourself. I got this woman that keeps on going to her brother's place, and he beats her up every time, because she tells him about this. You got to stop one or the other, you know. You have to empower yourself. To be abused again and again by your perpetrators, one of the things is you have to begin to, in a sense, you have to kill them in your mind. In a sense, you have to come to terms with their death. Okay? You go through a kind of symbolic death. You go through a little death and burial for such a person. See, the thing is, too much, especially with Christian therapists and stuff, there is too much. Too many people focus on forgiving prematurely, and I think it's very, very dangerous. Some of us may have had buffoons and,